So I chose the field of urology because during medical school I decided that I wanted to do a surgical field. I like the idea of using my hands to help the human body heal. Urology was particularly appealing to me because it's not only a surgical subspecialty, but there's a strong clinical base as well. While some patients I see I can treat right away with surgery to help improve their quality of life, there are other urologic conditions that are more chronic, and I get to establish that long-term patient care with. So while I am a urologist, I did my urology residency at Mayo Clinic in Rochester, Minnesota. I do general urology and treat both men and women for general urologic issues. I also did specialty training in female urology, reconstruction, and voiding dysfunction. So what that means is that I also treat things like pelvic organ prolapse, and I have advanced training in incontinence and voiding dysfunction, which obviously affect both men and women, but in particular things like overactive bladder, urinary urgency incontinence, stress incontinence. So that sets my practice a little apart from maybe my colleagues in urology as well. Listening to my patients is very important in my field, especially because of the main things that I see. They're very sensitive topics, and it's oftentimes difficult for patients to even bring them up with their physician. So I need to be able to gain that rapport and trust so that my patients trust me and then trust my recommendations, and we can work together to improve their quality of life. Well, most of my time outside of the office is devoted to my 2-year-old daughter and my family, but we love to get outside as much as possible. My husband and I have always enjoyed hiking and kayaking and things like that. We haven't quite built up the confidence to do it with our 2-year-old yet, but we're planning to do that soon.